Hi, I'm Dr. Angila Jaeggli with Dr. Anastasia Jones. Welcome to Sage Health TV, and today we're going to be talking about chronic and acute pain, and we're going to dive into, what is pain in your body, exactly what's happening, what are the things that we find are contributors to your pain, and then, what are things that we look at to work on a very holistic treatment of that pain.
Yeah, I think that's a great topic. We have a lot of patients that come in very specifically for pain, whether it's an acute injury that is not healing and on its way to becoming chronic, or people who have just been dealing with chronic pain for years, and often even with patients who come in for other reasons, whether to establish care or for another reason when we ask about musculoskeletal pain, joint pain. More often than not, people are struggling with some type of chronic pain, whether it's low grade or intense, and it's just sort of become part of their life.
Right, so, absolutely. Yeah. And, you've mentioned, musculoskeletal, mentioned, it really can vary. I mean, people have migraines or fibromyalgia, or, headaches that are coming from their neck, or as you mentioned, a knee pain or shoulder pain or multi-joint pain. So really, I mean, pain can exist in many different forms and of course on many different levels, right, in severity. So really we want to get into, we're going to give you a broad overview, of things that if you're in pain, and it might include any or multiple of those things, what are things that you can, or we'd love to see you if you're dealing with this and you don't have somebody, an active holistic team helping you, we would love to help you with this. What do we start to break down to kind of assess, what's contributing to your pain?
Yeah, and we want to be really clear that pain has a purpose often, right? So when something is off, whether something has been damaged, something's out of alignment, we get this signal from the area of pain to the brain that tells us something is awry. But sometimes, unfortunately, that signaling itself goes awry and we get locked into this loop, this pain loop, right? Where even if things have started to resolve in that localized area or they're stuck, we, that's when we get that inflammation and chronic pain loop. And so we really like to look at it not just for like shutting down the pain or covering the pain up, but we want to talk about long-term solutions and not just pain management.
Exactly, exactly. So starting out again, does depend on the type of pain you're dealing with, but first thing we feel like is really, really important is looking at your structure. So if you, for instance, have knee pain and you're like, well, could be from injury, but if you've had that knee pain for any significant amount of time, you start changing the way you walk, you shift your hips in different, which goes all the way up your spine into your neck. So we do things to help work on structure, but we also bring in other people, as a team. We really like holistic chiropractors, physical therapy, orthopedic docs. So depending on what you're dealing with. But that structure is key. It has to be realigned.
Absolutely. Critical. Then we want to start looking at overall inflammation. So if somebody is inflamed, and a lot of us are, if there's active inflammation happening in the body, if that is not calmed down, basically healing can't happen. So you can get the structure aligned, but if inflammation is continuing to run rampant through the body, you may not feel it in your whole body, but if there's inflammation, you will definitely feel it in those areas where there's been damage to the structural integrity, or you'll get consolidation in those areas. So we really want to look at like what, are you inflamed? We have lots of ways of checking that, and if so, why?
Exactly. And one of those things that's a piece of that inflammation, especially I would say probably more unresolved, like an acute that turns into chronic or extended chronic pain, is dietary. So probably people get kind of tired of hearing this, but we all have certain foods that our immune system really does not care for. And there are some common ones like gluten, wheat, soy, corn. But sugar is a huge
pro-inflammatory food. Yeah, and we talk about this a lot.
Yes,
for everyone.
Yes. Right? Every single person, unfortunately. But then we all have individual things. Like unfortunately, mine is coffee and almonds, which is horrible. But then we get into just general, like again, there are reasons why the foods that are inflammatory, like for instance gluten being high lectin, and there there are also other seemingly great, healthy foods like tomatoes and cucumbers that are also highlighted.
The nightshades, yeah. So once again, it really depends on the person, and we don't say there's not a one size fits all for everyone. It's really about looking what might be doing that to you. That brings us directly into gut health, right? So everything is really mediated through our gut, and inflammation is primarily mediated through our gut as well. So if we have a damaged gut, and the integrity, is not really intact from whatever reasons, I'm not going to go down the list that creates that damage. If we do not have a healthy gut that's able to assimilate our nutrients and also keep inflammation down in the body,
right.
It's there'll be more inflammation.
Yeah.
So that's a really also critical piece of the puzzle.
Yeah, just like miles long of tissue, that's inflamed. Which brings me to, the relationship between the gut and nutrient deficiency. So there are a couple of things that create nutrient deficiencies and pain. So sometimes it's the actual medications that you're taking to treat the pain, that your liver and kidneys have to work overtime to, metabolize those. So they're pulling on your vitamins. Sometimes just literally the act of creating, having inflammatory markers is actually pulling on your nutrients. And then say we, add on that layer of maybe leaky gut or gut dysfunction, and you're not absorbing the nutrients that you're getting very well anyway, right? Which is a recipe kind of for nutrient disaster, that we need to correct.
And then there's several other factors that play into pain. We're not going to get into them all today. We want to talk a little bit about testing. There's so many things we can test to help you narrow down and identify. On routine blood work, we look at the routine stuff, but we go a step further on a lot of the blood work that can still be covered, done through normal labs, but we really look at those markers of inflammation, the CRP and the homocysteine and the fibrin, all these things that, if we know you've got a high number there, we want to work on helping you to bring that number down by removing things, adding in other things. So we have, we don't just, once again, just give everybody the same plan to bring down inflammation. We have things we can look at. We can do GI testing, stool testing, food allergy panels.
Yeah, that's really, so again, individualized, but, each of those things are going to show up differently for every person. So which brings us to kind of what are treatments? What do we tend to kind of pull into our treatment wheelhouse to help you, get to the place where you need to be, which is out of pain. And one of the first ones, I would say, it's probably one of our favorite therapies, and goes in line with having, identifying nutrient deficiencies, but is IV nutrient therapy or IV vitamin therapy, which also has minerals, sometimes amino acids in there, which are, little proteins. So all of those, there have been research around a blend of nutrients that has been found to reduce inflammation, to address pain, to reduce muscle spasm.
Increase healing of connective tissue. And once again, it's really important to say two things. One, people will say, well, I'm taking a multi, or I take this and that.
Yeah.
You may not be absorbing it well because of gut issues. And also, what is needed for healing is very different than what is needed preventatively or for maintenance. So we're talking about therapeutic doses of nutrients, of vitamin C and magnesium, things that are going to really bypass the gut, get into your body, get into the tissues, and get the healing process sped up versus how much you can just get orally.
Exactly. Yeah. So again, bypassing any gut dysfunction, which is really one of the beautiful things about it, and why we see that it works so well, really, really well. And of course, nothing works 100% for everybody. We wouldn't just say that.
It's an important piece of the puzzle for some people.
Yes.
For sure. So.
And then we get into structure. I already touched on this, but really that part is really, really important. Whether it's neck pain or migraines where, misalignment of the neck is actually impinging nerves and contributing to the migraine, or whether it's fibromyalgia. Just because you have fibromyalgia doesn't mean you can't have misalignments all throughout your spine, hips that are contributing to that pain.
Yep. Yeah, and then, with the structural corrections, things like adjustments and whatnot, those aren't going to hold if the soft tissue is not also corrected. So that's where things like more physical therapy, massage, and then something we love here called trigger point therapy comes in, right? So when we've got those if there's a spinal rotation or just something's out of alignment and the muscles are spasmed around it, right? And they're pulling that out. If you can get those muscles relaxed and get those to release, you're going to hold those alignments so much better. And trigger point therapy is unbelievable for that. And we've both used it for a long time. And when you get in and you find those points and you get them released, people usually get some pretty instantaneous benefit, but then they also get that the ability for the other treatments to work
right better. Whether that's adjustments or sometimes specific injection into a joint, something like that. And that is a therapy I'd like to just mention. It's a traditional therapy, and many times can be covered by insurance as well. So which brings me to the gut. Now the gut, really, we don't always think of like, well, I've got both of my knees hurt, I have chronic arthritis, I need to think about my gut. It sometimes doesn't seem like it matches, but that is a really strong and important piece of your overall long-term healing, because one, some of the nutrients that we need for joint health, for instance, are very large molecules, and they have a difficult time going through your gut and being absorbed anyway. So if you already have inflammation there, it's not going to be that effective. So
one of our patients, and this is one of my favorite stories because it's such a simple one. Everybody's not this easy, but we have a patient who came in. He had some different things going on, but he had severe knee pain, both knees. Dr. Jaeggli ran a food sensitivity panel on him, came back through the roof on eggs, pulled the eggs out. He was diligent about it, pulled the eggs out for 3 months, and by the end of that point, and we were doing some IV therapy and a few other things, but no major things. He was able to go back to CrossFit, able to exercise, 0 knee pain. Most people come and they go, oh, I was a 9 and now I'm a 3 or a 2. He was like, nope, none.
Every once in a while we see that. It's very interesting.
That's probably why he's our favorite. But he says that now he'll eat eggs. He can eat one every one, and I'm not recommending this, but he notices though that if he has more than one egg, or if he eats a few eggs in a week, he's like, oh my God, my knees hurt so bad. So he removed the inflammatory contributor, let some of the gut heal up, right? And the pain went down. So that's one of those clear-cut cases of how close gut is to
absolutely. And I've seen that with migraines. I've seen that with fibromyalgia, and joint pain. It's quite powerful. So then, probably moving on to kind of another one of our favorite therapies is a type of oxygen therapy called ozone therapy, and that particular type of oxygen can actually be injected. It's a blood infusion. It sounds really strange, called major autohemotherapy, but has been around for a long time and studied extensively in many clinical trials, and goes whole body. So we get a very powerful release of oxygen, which drives healing.
And it's really a pretty simple procedure.
Very simple.
It's and Dr. Jaeggli, if you want to look on our YouTube channel and look through some of our other videos, Dr. Jaeggli has a great full video on ozone therapy you can watch that really explains how it works and how great it is.
It's a big driver of healing, and it actually is what we would call in the class of regenerative medicine. Not as strong as, say, a stem cell, but I mean way more accessible financially for people, and really we get really incredible results, and we pair that a lot of times with IV nutrient therapy as well as working on the gut and doing things to relieve.
So it's typically a series and a combination of treatments, but we really see results that way instead of just giving people a pain pill.
Exactly.
On their way,
Which leads me to our last, which is PRP, which is it's platelet-rich plasma, and this is a more probably many times we reach the PRP stage whenever we have maybe worked on other things first, and it's an extract of your own plasma that's been studied to stimulate stem cell production in your body and regenerate tissue space. So we can use that. Mostly we use PRP for working on joints and also like chronic tendonitis or muscle strains, things like that. So really powerful, and usually that's a discussion we have depending on where you're at and what your needs are.
So it's a lot of information. We touched base on a lot of things that might sound a little overwhelming, but once again, everybody's unique, and it's really often a combination of things that put us into a place of pain and a combination of therapies that are going to help get us out of that. if this sounds like something you're interested in, I really recommend that you find a functional or integrative medicine practitioner who knows how to deal with pain, but also knows how to address the underlying symptoms of gut health and inflammation.
Absolutely, yeah. And if you happen to be here, you know, we would love to be that functional medicine and integrative medicine doctor that helps you. So please reach out to us. We're available, and you can find us at sagemedclinic.com. Thank you so much for joining us today, and we look forward to seeing you soon.
See you soon.